Thank you, Speaker. So I rise to speak for the opposition in support of the Public Health Tobacco Amendment Bill 2024. And at the outset, I want to note that in addition to supporting the bill, the opposition will be moving some amendments in relation to illegal tobacco, which I'll come to later in my remarks. But first, I'd like to acknowledge the Health Minister for his commitment to this issue. I recognise this today is one of many measures that he has introduced to try to reduce vaping, especially amongst young people. And I share his concerns and hope that we can do so much more in a bipartisan way to help solve this significant public health issue. From July 1st, new Commonwealth laws came into effect, banning the importation, manufacture, supply and possession of vaping goods. But there are plenty who are flouting those rules and who continue to sell nicotine vapes to our kids. And why do they keep doing that? Because the punishment is so much less than what they stand to gain by marketing these products to children, by profiteering from the sale of these addictive and damaging products. Saturday night, I went into a convenience store just down the road with one of my boys, and when I walked in, there were 5 teenage girls there at the counter, and they were after vapes. And so the manager of the store reached underneath the counter and he pulled out a variety of different colours, different flavours, and they all purchased them. And my son pointed out, "Oh, Mum, he's also selling Galaxy Gas," which is a nitrous oxide capsule that is often used for the whipping of cream and other culinary issues, but it is dangerous to our kids and it is marketed to our kids. So stores that deliberately market vapes and other hazardous products to our children should feel the full force of the law. Now, I reported that store to New South Wales Health in an online form that's available to all members of the public via the Service New South Wales app, and I encourage other people in communities right across this state to do the same if they saw what I saw. We know what I saw was not an isolated incident. This is happening everywhere. They're being sold at convenience stores and tobacconists, which is why this bill is important. I'm invested in this on a number of fronts as Shadow Health Minister who's interested in the significant public health impacts of the rising nicotine impacts in our community. As a local member whose communities have got in touch with me and are very concerned about the tobacconists that are popping up everywhere, the school principals that are concerned about those shops turning up just down the road from their schools. As a mum of 3 teenage boys, the very market these vapes are being targeted at. And also as someone who, before I entered politics early last year, was the head of an organisation in the preventative health space. And one of the main things we did was try to educate young people about the dangers of vaping. And Life Education, that I was the CEO of, Healthy Harold, as many people remember, was part of over 40 years, a very concerted public health effort to reduce smoking levels. And it reached a near zero level until vapes came on the market. And I'm one of many people now despairing at the reversal of that very important work, this rise in vaping. There has been a substantial rise in people who vape over the past 5 years, particularly young people. The Cancer Council's Generation Vape research project found that 90% of young people aged 14 to 17 years found accessing vapes easy. 37% of 18 to 24-year-olds who responded were current vapers, and 80% were buying vapes from retail stores. Now, we have seen those tobacconists popping up everywhere, these brightly lit carbon copy shops that seem to sell American chips, American lollies, and you think, how do they survive? But they are everywhere. New South Wales health data estimates there are approximately 19,500 tobacconists registered across New South Wales. This is an increase from 14,500 just 4 years ago. To give you an example, in Sydney's inner west alone, there are 824 tobacconists. Smoking rates are going down, contrary to the rise in tobacconists. The federal government is losing, or has lost in the past, or since 2019, $25 million in tobacco excise that they had factored into their budget. Yet nicotine levels are rising in wastewater samples across Sydney and at record levels in regional New South Wales. Why? because people are being sold illegal vapes, but also there is a black market in illegal tobacco, colloquially known as chop chop. I have a pack here. I'm not going to use it as a prop today, given to me by a friend who bought this packet for $13, easy as pie, just going into the local tobacconist. The equivalent packet would cost at a minimum $40. A packet these days, I was shocked to learn, of Winnie Blues is about $60. So you understand why it's very easy for people to go in and buy a packet of these cigarettes in a cost of living crisis, but there are consequences to that. And John Crozier, a leading Sydney vascular surgeon from Liverpool, is very concerned this is leading to increased smoking rates, and he's been speaking to his patients about this very important and dangerous issue. He's worried about the legitimate retailers, and there are many legitimate retailers trying to do the right thing who are losing money on the other products that they're not selling on the side. But his biggest concern is a public health issue, and that is on heart and lung disease. So while there are many legitimate law-abiding businesses, we also know that behind the scenes there is an intricate web of organised crime that is importing both vapes and illegal tobacco. And that is why the opposition believes that this bill cannot address vapes without addressing the other half of the illegal trade, and that is in tobacco. Australian Border Force Commander Ken McKern has stated, and I quote, "There are well-documented links between the distribution and sale of illicit tobacco in Australia and serious and organised crime syndicates. Organised crime syndicates use illicit tobacco income to fund other illegal activities that cause significant harm to our community, such as illicit drugs. Organised crime syndicates pressure tobacco retailers across Australia to buy and sell their illicit product. They use gangs to enforce compliance, including torching tobacco shops, standover tactics and shootings." We've seen those stories in Victoria where more than 100 tobacconists have been subject to arson attacks, and there are fears that that type of gang activity is creeping into New South Wales. We've seen a spate of arson attacks on Central Coast tobacconists in recent times. So we must act decisively. So if enacted, this bill, and it is a good bill, but it would substantially increase the penalties for offences involving vapes, while leaving those for offences involving other illegal tobacco products untouched. And this may have the unintended and perverse consequence of simply skewing the incentive structure for criminal organisations to move away from supplying vapes towards black market cigarettes, especially when the fines are about 10 times lower. That's why we'll be introducing amendments, and I'll speak to those at the appropriate time. But Speaker, turning to the content of this bill, the bill has been brought about to support the enforcement of the Commonwealth's vaping reforms. From the 1st of July 24, the importation, manufacture, supply and possession of vaping goods was banned by the Commonwealth under the Therapeutic Goods and Other Legislation Amendment, Vaping Reforms Act 24. Under those new laws, vapes are available for therapeutic use and can be supplied by pharmacists, medical practitioners and nurse practitioners. This bill creates offences and increased penalties for the unauthorised supply and possession of vapes. The bill does not intend to criminalise the possession of vaping goods for personal use, which is an important point to stress. The Parliament's inquiry into e-cigarettes made it clear that we should not be seeking to criminalise personal use of vaping. As we know, there are people who struggle with nicotine addiction, and we also don't want young people struggling with vaping addiction getting caught up in the criminal justice system. This bill proposes to amend the Poisons and Therapeutic Goods Act 1996, Poisons Act, the Medicines, Poisons and Therapeutics Goods Act 2022, the Medicines Act, to introduce offences modelled on the Commonwealth Government's recent vaping reforms and make consequential amendments to the Criminal Procedure Act 1986, the Public Health Tobacco Act 2008 Tobacco Act, and the Smoke-Free Environment Act 2000. The bill will create an offence for the supply of vapes except where it is by a person who is authorised to do so. The maximum penalty is 7 years imprisonment or 14,000 penalty units, which is about 1.54 million. The bill also creates offences for possession of commercial quantities of vapes, with penalties ranging from 330 penalty units up to 14,000 penalty units, and 2 years imprisonment up to 7 years imprisonment. These penalties increase based on the number of vaping goods in a person's possession. Commercial quantities have the same meaning as in the Commonwealth Act, being from October the 1st, 24, 9 vaping devices, 60 accessories and 400 mils of liquid. There are separate retailer provision offences to stop retailers from circumnavigating the new commercial quantity provisions, noting the commercial quantities are low. These offences prohibit a retailer from having more than 2 vaping devices, 3 accessories and 60 mils of liquid in their possession while in retail stores. Speaker, finally, these laws are entirely necessary and they are supported by the opposition.